Thank you. I'm so excited to be here today. As we all know, only what gets counted in the end counts, just because it has been made visible. It is vital that we measure critical issues and make this visible so that policymakers and programmers can be guided by evidence and reliable data in making the best cost-effective and right decisions, which will then lead to meaningful and impactful results. It also is important to ensure that all key partners have access to and capacitated in using these resources. This is the main intent of this webinar. For us in PMNCH, as the largest alliance for women, children, and adolescents, it is key to focus on evidence, bringing together more than 1,350 organizations in 192 countries across 10 different constituencies, including government, United Nations, academia, NGOs, healthcare professionals, associations, private sector, and youth-led organizations and others. It is vital that we are able to equip our partners with evidence-based advocacy, which is our core function. Our job is to build on and make available partner data and accountability resources and ensure that a larger base of partners are capacitated in their use, bringing these partners to act on these, which results that their collective advocacy becomes more powerful and effective than any one single partner can do alone. We will ensure that each partner will be equipped to influence change, better policies, increased and better allocated financing, improved service coverage, and better targeted interventions across other sectors as well than health. This is more urgent now than ever before. Unfortunately, due to COVID, increased conflict, climate disasters, the progress has slowed, stopped, or regressed for many key areas for women and children and adolescents. This is unacceptable. We all need to do better to reverse that trend and to get back to positive progress. This webinar is carefully designed with this in mind. We encourage colleagues to use this opportunity to learn about different profiles that the Countdown 2030 have put together. Note improvements done in addition to other analytical work and explore how Countdown profiles can be used also in combination with the global strategy profiles, important resources led by WHO. Please share these materials with your colleagues. These, together with additional accountability resources, will be included in our accountability portal on our website. These, we think, are vital in strengthening all accountability and advocacy efforts. There are several reasons why the profiles are key for strong advocacy and as an effective tool for mutual accountability. One, as you will see from the presentations, these profiles not only provide reliable and comparable data, but are organized in a way to make data much more readily accessible to decision makers, be it policymakers, program officers, or civil society activists. Second, the profiles play a dual role, being useful as a planning tool for governments and partners to get an understanding of how well or where existing efforts are in reaching women and children, which needed services, or where and for which areas funds and actions need to be further prioritized to reach outliers and those truly left behind. Three, these profiles serve as a tool for advocates to call out and hold governments and other partners to account for especially commitments made that are not being implemented or needed to make commitments where there exists commitment gaps. This year, we are at the midpoint of SDG 2030. A number of high-level meetings on UHC and the pandemic preparedness, as well as our own Global Forum for Advocacy, will take place. And there is an opportunity to show the lack of progress for the WCA. there is a serious level of need for accelerated priority and actions for women, children, and adolescents by global, country, and partners at national and leaders at national level. This triple C situation has led to women, children, and adolescents' health needs to be put on the center stage. We at PMNCH are working to mobilize partners to follow up on existing commitments, primarily as too often we see unkept promises, much which the vulnerable and those left behind end up paying with their lives. This is unacceptable. Where there is a gap and need to reprogram and or mobilize new commitments, this needs to be called out and addressed. I also want to bring to your attention the 1.8 campaign, or campaign 1.8 billion adolescents and youth, and the Global Forum for Adolescents. As again, we see from the data, adolescents are left truly behind in planning, programming, and delivery of services which would address adolescents' needs in an adequate and meaningful way. Countdown profiles are a critical tool to support all of this work. As you can see on this slide, country profiles is critical for contextual background when making the commitment so that it is response to existing realities, where and what needs to be done, how to prioritize scarce resources. This will help. It is essentially important as well as for an ongoing monitoring and review, and actions to be taken to achieve measurable improvements for every woman, child, and adolescent, and ensure remedies were applicable. Only by looking at data, analyzing and understanding what's happening and what are effective activities, we can make a difference. We, PMNCH, are here with you to support your efforts by coordinating global reporting, synthesizing knowledge, and bringing together resources and partners to advocate for change. Thank you, Countdown and partners. I look forward to this webinar and for all of us to use these excellent resources, complement these with data visualization tools, and incorporate it in advocacy and accountability efforts so that packaged rightly for the right audience at the right time and through appropriate mechanisms, our efforts bring a better future for every woman, child, and adolescent. I wish you the best in your important part in all of this and hope this webinar is useful and motivates you to do more and better. Thank you.